Breastfeeding is a wonderful thing that creates an everlasting bond between the mother and the child. It is liquid gold that contains numerous multivitamins and minerals to nourish your little one. But this journey is not a bed of roses. 90% of women experience pain and infection during their breastfeeding journey. Breast engorgement, cracked nipples, mastitis, and yeast infections are common problems during breastfeeding that can cause pain and makes your journey hard. If you notice redness, itching, or burning under or around your breast area, please don't ignore it, as it can be a thrush. Candida is a yeast naturally present in your vagina, gut, mouth, and skin. It gets active in warm, moist, and dark skin folds like under your breast. Breast thrush is described as shooting breast pain or a burning sensation. It usually occurs after or in between the feeding sessions. Follow along to know its causes, symptoms, and ways to prevent it. Hi, welcome to Nen Versa. On this channel, we talk about everything style, confidence, breastfeeding, pumping, and motherhood. If you find this video helpful in any way, please give it a thumbs up and consider subscribe to our channel so you don't miss any of our videos. Thrush infections can happen due to cracked nipples. The Candida fungus enters the cracked nipples and causes thrush. Some yeast cells transfer from skin to skin contact. If your child has oral thrush or yeast infection, it can be transferred to you as well. It can also happen due to the imbalance of good bacteria. If you have recently taken an antibiotic, you can have thrush, as antibiotics imbalances the good bacteria and Candida fungus. Yeast infection also occurs if you don't wash your hands after a diaper change or apply creams and ointments to your infected baby. The first signs of a breast yeast infection are rashes in the folds of skin, are also called intertrigo, itching, burning sensation, flaky and cracked skin around the breast, small round bumps that ooze foul smell. Your nipples may appear pink and the areola becomes red, dry, and flaky. And the last sign is nipple damage. If your baby has thrush, keep in mind that you and the baby will need treatment. A mild yeast infection goes away on its own. A severe one can take up to 15 days to go away. If it is not treated timely, it can lead to severe outcomes like inflammation, pain, and skin infection. If you have a mild infection, treat it with over-the-counter medicines. Apply hydrocortisone on the affected area to relieve the irritability. If it gets severe, it is advisable to consult a doctor and get yourself treated. Along with oral medications, some changes in day-to-day routine can also be helpful. Apply coconut oil to the affected area. It naturally contains antifungal properties that help reduce breast yeast infection. You can also add half a cup of apple cider vinegar in a warm bath and soak your breast for 20 minutes. The acidic component in apple cider vinegar will help eliminate microorganisms from your body, including yeast and fungus. In test tube studies, oregano oil helped eliminate 5 types of Candida fungus. You can add a few drops in olive or coconut oil and apply them to the affected area. Yeast infection grows in moist, warm places. There are a few preventive measures that can help you avoid the fungus. Completely dry your underarms and breasts with a towel after a shower. You can also air dry them by using a hairdryer in a slow setting. Always choose loose-fitted nursing tops with breathable fabric to avoid skin-to-skin contact. Change your breast pads after every 2 hours and make sure to use clean and dry nursing pads. If you plan to express milk, make sure the flange of the breast pump is clean and properly washed before use. You can feed your child the expressed milk during the thrush. Don't freeze it for later use, as it can make the yeast infection come back. Wash your undergarments and nursing bras with hot water. You can add white vinegar or bleach while washing them. Keep good care of physical hygiene. Make sure to shower every day and keep your underbreast area dry and clean. Make sure you are wearing nursing bras according to your breast size. Sometimes tight, underwire bras can also cause yeast infection. It is good to cut back sugars in your diet, as yeast feeds on sugar. Add yogurt to your diet, as it is the best natural probiotic that can help balance the flora and bacteria in your system. A nursing mother needs to eat healthy, rest, and take good care of herself. Don't panic about minor rashes and yeast infections. With proper care and prevention, you can deal with them. Always prioritize your health, because your child needs a healthy and happy mother. It is good to change your lifestyle to make things easier. Please avoid a few things while breastfeeding for a comforting nursing experience. We hope our detailed guide will help you with the things you should avoid doing while breastfeeding. Comment below and let us know ways to save time during breastfeeding.